when just before everything closed in March, I have to remember to look at my camera because it's a bit above me. We had, my patients were coming in and they're having nightmares. They weren't sleeping. So many of them. It was wild. I don't think I'd ever seen anything quite like it. And then, of course, as the last year and a half proceeded, we would just see these intense phases of stress or sleep disruption that would just really happen across so many people that were coming in, whether it was manifesting physically or in their sleep. So when everything closed, I knew that quite a few of my practice members, my patients, they no longer had access to all these stress reduction mechanisms that they would normally access, whether it was, an adjustment with their chiropractor, a massage, going for a workout at the gym, or even just seeing friends and family, right? Losing all those support networks. So I reached out to a few people I knew to try and give folks some tools they could work on at home so they could have wellness at home or healthcare at home. And I reached out to Dr. Cheryl because I knew that she was really into sleep, right? I was pretty new to that at that point. And she came on with Dr. Arturo, and we talked about insomnia, a little bit about nightmares, and it was really great. Like I know I learned a lot, and folks really appreciated it at that time. And it impacted me too. Like I was not sleeping well at all for a while there. So that's how I became part of Valued Sleep. But going through that just made me realize it's so tough when it's not easy for you. But this really brings me into my talk because a few years ago, yeah, you can start. Oh, okay. Cheryl's helped me with my slides. Okay. So a few years ago, we changed a few things around at the clinic. Really just brought on digital intake forms. And so I uploaded all of the questions that the Ordre de Chiro in Quebec had in the intake form that was available for us to use. And there was 2 questions about sleep on there. So again, as someone who loves sleep, like just loves it, always has struggled with it a little bit. I kind of just assumed that people slept enough if they could, right? If there wasn't something that was really stopping them from that. And it really blew my mind how few people were getting 7 to 9 hours of sleep, and didn't realize that for the ones that were actively struggling and seeking assistance for that, they didn't realize that this was an issue that could impact their health. It was really eye-opening. It was quite shocking. Yeah, next one. Okay. So, and bring out the big guns on this one. So we know that sleep deprivation is actually a form of torture as per the Geneva Convention. Like this is something that we're not supposed to do to people. We're legally prohibited from imposing sleep deprivation on someone else, but we do it to ourselves. So what I think is that a lot of people, they just don't understand. I know in Matthew Walker's book about sleep, he talks about sleep as if, if it was a pharmaceutical and we had that same style of marketing, everyone would want it, right? Like you'd absolutely want it. We think about exercise that way, nutrition that way, but people they're missing out on sleep for the ones that choose not to get 7 to 9 hours of sleep. And I'll get to that towards the end of my talk. So yeah, we know, for example, that 31% of Canadians suffer from sleep deprivation. And not all of those are ones that are working with, living with a clinical sleep disorder. That's good. Okay. And this is something we're seeing in a lot of developed countries. Gosh, I wish I'd put that quote in here, but I think I heard it after we did my slides. I think the founder of Netflix was quoted as saying that they're fighting against sleep and they're winning. So we have this privilege of, most of us are able to access this sleep 7 to 9 hours a night, and some of us we're choosing not to. Okay. So in terms of sleep, just reflect for a moment and maybe drop in the chat too. Like, what have you thought about how sleep impacts your memory, your mood, your performance, your appetite? Like, have you thought about that, or how does it impact you in those ways? Definitely makes me cranky. I'll say that for sure. And the memory will go really quickly for me. I'll be pretty fuzzy if I don't get enough sleep. Alrighty. Next slide, sorry.
Okay.
So yeah, we have this research at this point that really shows that, sleeping less than 7 hours of night, it impacts us in all facets of health. And we see here we have a quote, there's increased risk for obesity, diabetes, high blood pressure, coronary heart disease, stroke, frequent mental distress, and all-cause mortality. And I'm going to get to this a little later in my talk because, if you're joining us as a professional who works with other people, and you probably do know a lot of this, or maybe it's a refresher, we do always want to approach sleep in a way that doesn't create, and Cheryl talked about that actually, doesn't create or add anxiety for our clients or for our patients. So we're going to get there, but just keep that in mind. That's good. All right. So one of the things I notice is that we don't always have, like, who's following up on sleep, right? If someone comes into you and you are a clinician, or maybe you're a personal trainer, and they tell you they're not sleeping well, of course that's different, right? They're coming to you with that issue, and then you can help them with it. But who is just checking up on sleep to see who's not getting enough and taking the time to educate that individual on how they maybe want to work on and address that. Next slide. Okay. So this just takes me to, where I was in practice before I started just asking everyone 2 simple questions about sleep. And it's kind of beyond that activities of daily living. So, again, for clinicians, often someone comes in, and if you've been practicing long enough or working with clients long enough, then you'll probably realize that in terms of pain management, it's often not the pain itself, or it's not always the pain itself that finally brings them in. I had people that waited like 10 years to finally come in and address physical pain they're experiencing. It's often something else that gets impacted in their day-to-day. We'll put up with a lot of pain before we seek relief, I've found over the years. And so one thing I would see is that someone would finally come in for care because, maybe they'd had some neck pain for quite some time, but they weren't sleeping well anymore. So we just want to think about what it is that, like, when someone's coming into you, what's motivating that? What do you want to work on with them in regards to that? And maybe instead of just waiting for them, when you ask those questions, like, how is this pain, or how is this impacting you? How do we want to engage with sleep on a more consistent, a more regular basis so that people aren't missing out? Next. Okay. And that just ties into thinking about care coordinators or even generalists, right? So you don't have to be the expert on sleep to ensure that your clients or your patients get connected to the right resources. I know that's one of the things that we're really excited to build through the Sleep Well Network. Is I've often found that, maybe someone has flags come up and you send them into a sleep study, they're not sleeping well. And sure, they go through the sleep study, but if they come out of that and they don't have that diagnosis, or maybe they don't meet the criteria to even go into a sleep study. A colleague of mine was saying they have a sleep hygiene handout that they hand out to folks, but that might not be the level of support that someone needs. So we just need to know, who should be checking in on sleep. Where do we send people that kind of fall through the cracks, that need help with their sleep, but they don't have a medical condition that they're going to be, assisted with quite specifically. Okay. So we have some really great talks coming up today. Mine was really meant to kind of orient us around where are we now, or where are you now? Where are you going? And to just reflect really on what you're doing right now. So, right. Oh yeah, wearables are great. That's a great question. I sometimes do wonder, because often the folks are self-reporting sleep, right? I have wondered a lot recently how accurate that reporting really is. And I'm sure Cheryl has seen those studies, but it's really made me wonder if we should just have folks wearing wearables a little more often to really get a gauge. And I did that after I mentioned I was struggling with sleep. And so at the time, wearables weren't really available, but you could put an app on your iPhone and place it next to your head when you were sleeping, and it could check motion. And that's, I think, when I went, holy, my sleep was even worse than I thought. I could see how bad it was. So wearables can really be helpful for sure in letting someone know that they're not sleeping well. Okay. So what are you doing now? If you do work with clients, what are you doing now to address sleep quality? Next slide, I think. Yeah. Okay. Okay. So like I had mentioned before, I really waited until someone told me they were struggling with sleep before I might, direct them on their next steps for that. So is that where you are right now, where you're waiting for patients to bring up issues they're having related to sleep? And depending on your training, you might wonder how it is that you don't start with sleep already. But you're just going to start where you're at and then decide where you want to go from there. Or, are you doing what I do now, which is screening all of your new patients for sleep quality? And, what questions are you asking? And Cheryl and Myra will talk about that a bit later. Okay. So just sit for a moment too and just think about, how do you see sleep? Sorry. Because there's a few different paradigms in regards to sleep. Okay. So I know some of us at Somnolence Plus, we really see sleep, or some see sleep as being a series of pillars. And, so there's movement, nutrition, sleep, mental health, just a few different things. And that, ideally we address all of them, but you could probably not be doing well with one pillar and still, be doing really well in regards to your overall health. Okay. Some of us, and this is how I see sleep, is we really see sleep as foundational, which is that sleep should be the thing that's looked at, that should be addressed really before we even look into other aspects of health and wellness. And I'm just going to put in a caveat here, and we're just getting there as well, but you need to be really careful in how you do approach this with folks. Like, for example, if I have someone that's in front of me and I can see in their intake form that they have a diagnosed sleep disorder, maybe I might switch paradigms for the day. You really have to be very careful with how you approach this, because I know when I get really excited about a new topic, I want to share it with everyone, but you don't want to create more anxiety or more stress around something they may not have control over. So just be aware, regardless of which paradigm you're a part of, or really speaks to you, just careful how you engage with that. Okay. So we have some paradigm shifts that we're looking at as well today. All right. So again, when we look at who are we asking, are you asking all of those new patients that are coming in, only ones that talk to you about sleep? When are you asking them? Do you ask just in their new patient consultation? I know this is something I need to work on too, in terms of when I do a reevaluation, when someone's been away from me for a while, or they're coming in with something new, is I don't have a system where I consistently, in the same way with new patients, I'm asking about sleep. And that's something I need to integrate. I need to work on. I think you can do the next one. Okay. Yeah, so exactly. When you begin to work with them at regular intervals, one thing I would say is that for many years, I certainly would, when someone came in and things were feeling more sore than maybe the previous time I'd seen them, is I would check in and say, how's your stress? And sometimes that would kind of be the ticket. But more recently, I'm also asking, how's your sleep? Because sometimes your clients, they won't tell you that these things are going on. But when you prompt them, they say, oh, you know what? Actually, I haven't been sleeping well this past week. And then you can have a conversation with them about it. Yeah, exactly. Like, I think, and I've seen it myself as a clinician and a patient, is that we have to be very careful in how we approach anything we talk about, because we want to always empower folks to take action for their health, but we need to do it in a way that doesn't ultimately disempower them or create anxiety. And we need to recognize different barriers someone might have too. For example, if someone is coming in and they have a brand new baby, I'm not going to harp on them about sleep. Maybe I'll connect them with someone who does sleep education for babies, but I'm not going to give them a hard time about sleeping 5 hours at a time, because they're in a situation where it's not possible, or the conversation is going to be different if someone's a shift worker or has young kids at home, like you really have to stop and look at who's in front of you, and you have to tailor the conversation to them. And that is very important. Okay. So how is your sleep? I mean, I saw in the chat, there's a few people that, they have their own sleep stories, but just check in, like how is your sleep now? And as the talk goes on, there may be some things that come up that make you go, maybe you need to work with someone with your sleep. Okay. And this is a big one. So how is your relationship with sleep through your professional training? Depending on what that looked like even in chiropractic school where, we're value kind of a lot of things like sleep and movement and nutrition in a really big way. Were you studying and pulling all-nighters? Was that kind of the culture you were a part of? What did that look like for you? Because that there may be some things you need to unlearn about sleep. Oh, sorry.
Natalie's saying something.
Oh yeah. Okay. Yeah. Yeah. It's sometimes it's nice that someone would just ask you about your sleep, especially if it has been a struggle, because then your clinician can just know that might factor into like how they provide care for you. It's really important. Okay. Yeah, that's good. All right. And, what is your relationship with sleep now? Like, are you in a phase of life where you have a tiny baby at home and they have different sleep needs than you? Or maybe you're are you doing shift work where there's not a lot of control over how you're doing your sleep? Or are you part of an institution that is like kind of bragging about how little sleep they get? Okay. What sleep? Yeah. And I think the point here I'm trying to make is that, I mean, I always feel like, our patients, our clients, they kind of know is that we want to walk the talk, right? Like if we're going to get excited about sleep, then we need to sit and reflect what's going on with our own sleep. And if there's some room for improvement. And of course, again, even for yourself, if it's not ideal right now, let's not get anxious about it, right? Sometimes I like to think about different aspects of health as existing on a dial. So ideally, we're not at 0, no sleep ever. You wouldn't last long that way. But there might be times in life where you're, at the 5 or 6 on the dial, where you're not quite getting the 7 to 9 hours. And there will be times when you're all the way up at 10 on that dial and you are getting your 7 to 9 hours of sleep and it's restful. So, just be kind to yourself too.